I chose the Wright Center for the innovative model and the focus on community medicine. It has a wonderful vision for what medicine is to become and what it actually needs to be.
I was looking for somewhere that both offered a very solid foundation in primary care, but also offered an experience that was teaching me to be at the forefront of where medicine is going.
When I came here for interviews, I really liked the place. I liked the integration between the faculty, the residents, the nurses, and the staff. And most of all, I liked the variability of the venues where we provide care to our patients.
One of the things that struck me about the Wright Center was how forward-thinking everyone was. From the minute I met Dr. Eleni O'Donovan until the end of my interview day, everyone was talking about solutions to the healthcare, kind of issues that we have going on in the country. And that was very refreshing.
When I first heard about the Wright Center and the National Network for Family Medicine, it was exactly what I wanted to do. It was training in the environment with the patient population and with the doctors that I want to work with in the future and the population that I want to serve.
I really like internal medicine, especially primary care internal medicine. So I know the Wright Center, the strength is primary care internal medicine.
I thought that there was a need for internal medicine physicians, and I thought I could help.
When I first came to the United States, I was looking for a program that would give me the medical knowledge that I'm looking for, and I'm really looking for more outpatient experience. I know that the Wright Center would offer this, including the teaching health center track, which offers us a bigger portion of outpatient exposure and to the new model of the primary care settings. I thought this is going to be this is the future of the healthcare system in the United States.
The Wright Center's culture is a culture of compassion, but it's also a culture of excellence. And that really meant a lot to me. When I speak about this program to younger medical students or people that are pursuing medicine, they connect with it because our generation is hyper aware of what's going on with the country, with medicine. And a lot of the conversations that are had within the Wright Center and the policies, they resonate with the newer group of physicians and people who are trying to make a change.
It combined all the things that I'm most interested in. One, I wanted to stay in my hometown of Portland, Oregon, and the Wright Center offered this new program that had various sites across the country, one of them being in Portland. Also, the local sites in Portland were two institutions that I really respect.
I think working in a community health center is completely different than working in, say, a hospital. We do both. However, the relationships that you get to form with your staff, with your patients, with the attending providers is incredibly different and I think more diverse and requires, I think, a lot of different things, and relationship and communication skills are just something that you definitely have to develop in that environment.
We in the Wright Center, especially in the internal medicine program, the local program in Scranton, we go for various venues for education. In 4 hospitals, at least 3 clinics, including an HIV and infectious disease clinic. One of the most important interactions that I had was in this HIV clinic.
Just exposure to so many different sites, so many different EMRs. Even though my thesis as a part of my public health program was EMR, but I didn't know the extent to which it could impact doctors and their practices. So being exposed to 2 or 3 different clinics, 2 and 3 different hospitals, it just inculcates that quality in you, which is, I think, one of the most important one to have if you are trying to establish yourself as a practitioner.
I really like the residency training. Because the Wright Center residency training, we have 4 different hospital training places, including VA Hospital, SAMC, Regional Hospital, and Moses Tyler. We also have 4 or 5 outpatient clinical training. This help resident to familiar difference the system
So I think all meaningful experiences include patient care, and I had one faculty member who is a locum. He comes from Washington State, and very knowledgeable man, very kind person, and I like to take a little bit from each person that I talk to and incorporate it into my style. But we had a patient together, and just the way that he went about teaching, very patient, very kind, very thoughtful.
I really like Dr. Linda Thompson, and she actually, before I joined residency program, I also did a 1-year observation at her clinical office, and then she teaching me a lot, and also I also learned a lot from her. She's not only as a primary care physician, she's also the leadership as the Wright Center, as the residency training, and she also has very wonderful teaching skill.
There's no barriers with the faculty members. If you have a question and it's 10 o'clock at night, you can call them. If it's 6 o'clock in the morning, you can call them. 2 o'clock in the morning, you can call them. They're wonderful teachers. They really just have the main goal in mind, which is excellent care. So the patient is the #1 priority.
Patient-centered medical care is care that is all about the patient and their family, because we often forget that patients' care is very important, but their family is important because it affects their care as well. And so it's something that is well coordinated between all staff, all doctors, physicians, MAs, all of those people, the patient, and it's something that the patient drives. You are there to support their decision to make whatever healthcare choices they want, and you are there to educate, but not to tell them what to do, but to help them find the best thing for them.
The way I would define team-based healthcare is complicated. There's many different aspects that you're trying to coordinate in the care of one patient. There are many different things that happen throughout the course of their hospitalization or their multiple clinic visits. And so there's a lot of moving parts. And I think the old model was that the physician took care of those things and that was it. But I think in reality, given the fact that technology is changing so much and we are all trying to kind of keep up with it, there's a lot of things that you have to kind of fit into a nice little package, and the team really helps to do that.
In team-based healthcare, everybody's operating at their highest level, and I think that helps it so that I can focus on the more complex cases that I was trained to focus on, and other people in the team can focus on their strengths. If they're a pharmacist, they can focus on providing the best pharmaceutical care and so forth, and that way everyone can bring their specialties to the table, and together we can provide the best care for our patients.
So my projected career path is to practice as a broad spectrum family practice physician in a community health center to serve my community, of course, in local Tucson, Arizona.
When I first came in as an intern, I was raw. I didn't know anything about the system of healthcare delivery in the United States. Like dealing with EMR, not paper charts, dealing with healthcare disparities with minority and ethnic and racial group, and I was kind of afraid. The faculty members as well as my senior resident have helped me through the first couple of months, and then by the end of first year I was very comfortable dealing with a new system. By the end of my third year, I feel that I am now a good teacher for upcoming interns, and actually I enjoyed during my whole third year teaching them what I lacked upon entering the Wright Center. And by this continuum of education, you are maturing from a learner to a teacher to a leader, which is, I think, the main role of a physician nowadays.
Oh, I'm actually very fortunate that the Wright Center selected me to become one of their residents, and I feel like I've learned a lot about community, about what it means to really care about a patient, what it means to be a physician who wants to do more than just patient care, but to build something. And the Wright Center has really granted an opportunity to be a part of an innovative and new experience for, I think, all Americans eventually, in terms of new healthcare prospects and stuff.
This innovative program has changed my life really by allowing me to maintain the connections I have to my community. I think in medicine, too often we are forced to relocate, and I don't think we really fully grasp what it means to move away from our communities. For some reason in medicine, that's part of the rite of passage, is to go off and train, and then oftentimes folks never come back. And at the Wright Center, I've been able to maintain my connections, strengthen them, as well as receive high quality medical training.